It seems so unfair, but weight gain from psychiatric medications is a significant problem, frustrating many and leading to worsening metabolic health and an increased risk of heart disease, among other medical conditions. But you don't have to suffer from unrelenting weight gain, and you don't have to take untested and expensive medications to lose the weight. Ketogenic therapy has the potential to help you safely lose the weight and possibly improve your psychiatric symptoms. I'm Dr. Brett Scher, Director of Metabolic Mind, and we'll get into the details. But first, please remember, our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision. So consult your healthcare provider before changing your lifestyle or medications. Now, let's be clear. Psychiatric medications can be life-saving. Antipsychotics, antidepressants, and mood stabilizers can help save someone's life from episodes of psychosis, mania, or suicidal depression. But a serious long-term effect is weight gain, with studies indicating more than 50% of patients experience significant weight gain, and real-world experience suggests much higher numbers. The problem is that most doctors give the same generic advice for any weight loss, and it's mostly ineffective. But it doesn't have to be. We can target psychiatric medication-induced weight gain in ways that reduce hunger, improve metabolic health, help you succeed with the weight loss, and may even benefit the underlying psychiatric condition. And one such method is with ketogenic therapy. So first, let's talk a little bit more about the scope of the problem. Now, one study reported people with a first episode of psychosis starting an antipsychotic medication gained an average of 7.5 pounds in only 44 days. And this was accompanied by worsening metabolic health. Now imagine if that trend continued for months or years. Other studies suggest an average weight gain of 2 to 4 pounds per month on many psychiatric medications, with over 20% of people gaining more than 22 pounds. And again, real-world experience suggests much higher percentages with much greater weight gain. Now, the most common offending meds are antipsychotics like Abilify and Thorazine, Zyprexa, Seroquel, Risperdal, mood stabilizers like lithium and Depakote, and Tegretol and Valproate, and antidepressants like Paxil. And as I mentioned, the most common advice psychiatrists and primary care doctors give is to eat less and focus on portion control. Eat whole foods and fruits and vegetables and whole grains, avoid sugar, drink lots of water, chew slowly, don't eat while distracted. In other words, the same advice healthcare professionals have been giving for decades for weight loss that frankly doesn't work very well for most people. You may have experienced this unwanted and unrelenting weight gain firsthand, but if you haven't, try to imagine what people must be going through, as if it's not challenging enough to live with mental illness, trying your best to get better every day with inconsistent thought patterns and juggling the stresses of the rest of your life, only to find stubborn weight gain increasing day after day, seemingly no matter what you do, even if you're doing exactly what your doctor told you to do. Now, part of the problem is that this general weight loss advice does little to address hunger and satiety. And we know many psychiatric medications induce weight gain by altering hunger and satiety centers in our brain, resulting in increased hunger and decreased feeling of being full or satiated. And some medications, like SSRIs, over time can lead to a downregulation in serotonin receptors. This can be associated with carbohydrate cravings, leading to unhealthy weight gain and metabolic dysfunction. Therefore, any strategy to combat medication-induced weight gain should target these specific mechanisms. Perhaps that's why there's some enthusiasm for using GLP-1 agonists like Wegovy and Ozempic, which help with feeling full and decreasing hunger. But we understand the frustration, right? From patients, from doctors, psychiatrists, primary care doctors. The weight gain and metabolic dysfunction are unacceptable. Weight gain and metabolic dysfunction can dramatically reduce one's quality of life and increase the risk for future medical conditions from type 2 diabetes and heart disease, or possibly even cancer and neurodegenerative diseases. And at Metabolic Mind, we want to help address this. Now, we tend to focus on the role of ketogenic therapy for treating symptoms of psychiatric illnesses. But it's also pertinent to discuss ketogenic therapies for weight loss, specifically psychiatric medication-induced weight gain. Now, remember when I said many psychiatric medications induce weight gain by increasing hunger, decreasing satiety, or even increasing carb cravings? Well, it turns out studies indicate nutritional ketosis helps with all of those exact mechanisms. Studies comparing a calorie-restricted low-fat diet to an unrestricted keto diet, meaning in the keto group, they could eat as much as they wanted, but in the low-fat group, they had to purposely reduce their calories. So studies comparing these groups show that the keto group naturally eats fewer calories. They eat fewer calories despite not trying to reduce their calories. They experience less hunger. They experience better feelings of being comfortably full and therefore spontaneously reduce their calorie intake. Now, does this happen to everyone on a keto diet? Maybe not, but it does happen for most people. And clinical experience suggests it happens to practically everyone following a whole foods ketogenic diet. But here's another critical point. When we talk about weight gain from medications, we gain mostly fat mass. So when we lose weight, we want to lose that same fat mass and not the fat mass plus some of our lean mass. Now, being active and doing resistance training and eating plenty of protein can help, but studies also report that following a keto diet helps lead to greater fat mass loss and less lean mass loss when compared to low-fat diets. So aside from weight gain, metabolic dysfunction may be the most harmful adverse effect of psychiatric medications. And again, nutritional ketosis has demonstrated better metabolic health improvements compared to controlled diets. That doesn't mean keto is the only way to lose weight and improve metabolic health, but it is likely the most effective dietary approach. And here's one more thing to consider. Not only does ketogenic therapy provide weight and metabolic health benefits, but research and clinical experience demonstrate ketogenic therapy can improve psychiatric symptoms and can lead to requiring fewer medications. It's a pretty powerful combination that makes it seem like a clear first choice to use ketogenic therapies when starting psychiatric medication. So what prevents doctors from trying ketogenic therapy? Well, really two things. The first is not being aware of the clinical and research experience. So this is where you can help by sharing our resources and those of others in metabolic psychiatry with your clinician. The second is a misunderstanding of ketosis, believing it's dangerous or that it even increases heart disease risk. But ketosis is not dangerous. In fact, it's a natural evolutionary process. And ketogenic diets don't increase heart disease risk. And we have dedicated videos on these topics that we encourage you to watch. So if you are experiencing weight gain or metabolic dysfunction from psychiatric medications, please make an appointment to speak with your doctor about considering ketogenic therapies, and look for an experienced dietitian or health coach who can help you transition into ketosis and work with your clinician as part of an integrated healthcare team. You can get started by checking out the directory at diagnosisdiet.com. See if you can find a clinician. And you can also watch some of our introductory videos to help you gain some of that background knowledge. Or even better, share this video and others with your clinicians to help them understand the efficacy and safety of ketogenic therapy for mental illness. You don't have to suffer from unrelenting weight gain, and you don't have to take untested and expensive medications to lose the weight. Thank you for watching. We hope this was helpful. If it was, please click the thumbs up and subscribe buttons so you won't miss any of our future videos. And leave us a comment. We'd love to hear from you. What's your experience with medications? Have you experienced medication-induced weight gain? What's worked or hasn't worked for you to target that weight gain and metabolic health? If you've tried ketogenic therapy, we'd love to hear about those experiences as well. So thank you again for watching, and we'll see you here next time at Metabolic Mind. I'm Dr. Brett Scher.